Hello, I will be the member of opposition for today's debate topic, which is the United States federal government should pass Medicare for all, expanding Medicare to cover every American's health expenses. First, I'd like to remind everyone of the impact that Medicare for all would have on us if it were to be implemented. As formally stated by the LOC, Medicare for all is counterintuitive and does not solve any of the harms presented. Medicare for all would limit the availability of doctors and treatments, has poor outcomes for common illnesses, and will cost around $32 trillion in its first decade. Now, adding on to this, Medicare for all would limit the availability of doctors and treatments, as there would be an increase in wait times. Canada is one of the top countries that is always brought up when the argument that a universal healthcare system happens. However, according to an article by Forbes.com titled, "Canada, Not a Good Example of Universal Healthcare," the most visible manifestation of Canada's failing healthcare system are wait times for health services. These wait times are not simply minor inconveniences. Patients experience physical pain and suffering, mental anguish, and lost economic productivity while waiting for treatment. One recent estimate found that the value of time lost due to medical wait times in Canada amounted to approximately $1,200 per patient. This is coming from a country who only has 38.25 million residents in comparison to the US with a whopping 131.9 million. Imagine how longer wait times will be with that amount of people. This also goes in hand with having poor outcomes for common illnesses. As a response to the affirmative harms that there are currently too many insurance providers in the US, the LOC stated that these insurance providers are necessary, as a one-size-fits-all system would not work for everyone. This is true, as people should have the choice to decide what procedures, treatments, or additional care that they would like to receive. A single-payer system like Medicare for all would infringe on people's rights to that choice, since people would have limited options. Moving on to the responses from the affirmative. The affirmative insists that Medicare for all would improve the well-being of people and lower costs. The reasoning for this is that the universal health care would not have limited access to care, since according to the World Health Organization, universal coverage means that all people have access to the full range of quality services that they need, when they need them, and where they need them, without financial hardship. While this does seem like a nice idea, everyone getting the care that they want whenever they want for little to no cost, unfortunately, it does not work that way. Single-payer systems such as Medicare for all have budget caps, which means that there is a limit to care that people will be receiving. According to an article by Coronis Health titled, "Pros and Cons of Universal Healthcare, aka Medicare for All," there is usually a set budget amount to pay for the public's access to medical procedures. When that cap is met, there is no room for more. This leaves patients needing surgeries and other treatments waiting until the next fiscal budget is released. In turn, the overall quality of care becomes diminished for those who desperately need the services the most. The affirmative says that our claim that Medicare for all will cost around $32 trillion in its first decade is unsupported. As mentioned a couple minutes back, this number has been publicly stated from former presidential candidate Bernie Sanders. The affirmative also says that according to the federal government, we will spend around $42.9 trillion on healthcare over the next years, which is $10 trillion more than what we stated. Even if this were to be true, it is a drastic proposal to completely change our current system and put ourselves in risk when Medicare for all fails. Instead, we can use the money that would be spent on starting up Medicare for all to fix any flaws that might be present with the system we have now. According to an article by Forbes.com, the American Medical Association has a firm perspective on universal healthcare. Instead of providing free or low-cost coverage for everyone, the group prefers a different approach called healthcare for some. With this approach, private insurers would stay in business and be available for those who need it. However, lower income or those diagnosed with specific serious health conditions would have access to government-funded care. Considering that the majority of Americans would be financially worse off under Medicare for all, this seems like a better option. The affirmative says that the statistics that we provided regarding Medicare are not relevant to the topic of Medicare for all. However, Medicare is often mentioned when speaking about Medicare for all, as it is a smaller scale variation of it. The affirmative claimed it is not relevant, but did not elaborate on what makes them different from one another. One of the only differences that I can find is that the age requirement would no longer exist, and everyone would receive medical benefits through Medicare for All. If this is the case, and they are more similar than not, it indicates that at a larger scale, it would become even more unstable than Medicare is now. The affirmative agreed that a single-payer, one-size-fits-all system would not work in the U.S. They say that patients will be able to select the where, why, and whom they seek treatment under Medicare for All. This might not be true. According to an article by GrassleySenate.gov, Medicare for All is a quick fix. The plan only serves to give the federal government even more control over our personal healthcare choices. That includes deciding what specialized medical procedures, prescription drug therapies, and medical device innovations we're allowed to receive. The affirmative disagreed that Medicare for All would negatively impact taxpayers. However, where is the money to fund this plan going to be taken from? The plan does not pay for itself. Taxpayers will be in charge of that. The plan makes it seem as if everyone is going to get access to free healthcare or at a lower cost, but this is untrue as they are paying for theirs and everyone else's healthcare through taxes. According to research conducted by the Urban Institute, even with higher taxes, there would not be enough funding, and there would only be enough to cover about 1/4 of the cost of a full-blown Medicare for All plan. The affirmative instead believes that implementing Medicare for All would relieve financial stress and completely eliminate medical financial bankruptcy, since it is one of the top leading causes of bankruptcy in America. However, how will this be relieved if, in order for Medicare for All to work, people would need to give up about 21.2% of their wages to the government? It would instead do the opposite and cause more financial stress. According to the affirmative, Medicare for All would create a $30 billion increased demand in health services, with 2.3 million jobs opening in the medical field. This is actually not a good thing, as it will lead to a patient surplus, with medical staff shortage. According to an article by the American Hospital Association titled "Healthcare Workforce Challenges Threaten Hospitals' Ability to Care for Patients." Despite increasing demand for healthcare services, hospital employment data indicates a critical shortage of staff necessary to meet that demand. While there will be people lined out the door waiting for their turn to get their medical treatment, the understaffed workers will be suffering from burnouts at a much faster rate.